Hello, everybody, and welcome to our second program in the Nurse Leader Coach video series. This program will be about coaching basics. I'm Dr. Rose Sherman. I'm author of the book, The Nurse Leader Coach, and I'll be your coach and guide for not only this video, but also the whole series. This video is one of 10 in the series, and today we're going to be covering coaching basics, or the skills that you'll need to move from a traditional leadership role to becoming more coach-like. Now, there are three goals for this program. Our first goal is that you will be able to understand the difference between a traditional leader mindset and a nurse leader coach mindset, including the types of changes that you may need to make in your own leadership practice. The second goal in the program is that you'll be acquainted with a leadership coaching model that you can use in your practice. It's called the GROW coaching model, and also some key coaching skills that you will need to add to your toolbox. And our last goal is that you will know how to get started and integrate these skills into your own leadership practice. So this program is divided into three parts. So let's get started with part one. And in part one, we're going to talk about how can you develop a coaching mindset and really avoid being an advice monster. You know, as we talked about on the last program, to become a nurse leader coach, you may need to make a transition in the way that you lead. Instead of focusing only on performance, you may also need to start focusing on the professional growth of your staff, because this is really what our younger staff members both want and need. Also, instead of just giving feedback when needed or using the philosophy that no news is good news, you'll need to consider providing much more frequent feedback. As a nurse leader coach, you also need to be more strengths focused. And this means spending less time worrying about what people's weaknesses are and more about looking at how you can use their strengths to really improve their performance. And finally, you'll need to move from thinking about what can I do for you to thinking more along an approach, what can we do together? Because coaching, as we talked about in the last video, coaching is all about a partnership. So, in order to be an effective nurse leader coach, you'll need to integrate coaching into your leadership mindset. And this begins with really believing that your staff can learn and grow from their experiences. This is an essential a part of coaching. You need to start with good assumptions about people and good intentions that they can get better, that they will develop. Even if you've seen some behaviors in the past that concern you about a person, don't let that really overshadow what you think that staff member might be able to accomplish in the future. If you doubt a staff member's ability to make progress, they probably won't make the progress. If instead you have high expectations, you may really be amazed at the progress that staff can make. People will, for the most part, live up to the expectations that you have for them. Low expectations, low performance. High expectations, higher levels of performance. Wise leaders also realize that the best solutions come from within. You know, a lot of times we get upset when staff don't take our advice. But what we fail to realize is that our solutions to the problem is sometimes not the right solutions for the staff member. Above all, coaching, you need to see coaching as a partnership. Now, if you're currently in a leadership role, more than likely you were selected for that position because you yourself are an excellent critical thinker and probably problem solver. And these skills are wonderful and they're important to have in leadership. But when you move into leadership, your role changes. You change from being an individual contributor to growing and developing your team. So it's no longer about you, it's about your team. Moving your thinking from what I can accomplish to what we can do together. And this means, as a leader, that to be a really effective coach, you need to be much more Yoda and much less Superman. Now, the metaphor of Yoda and Superman seems to really resonate with frontline leaders because here's the challenge. As we've discussed in the previous slide, most of you were promoted to your leadership role because you're really excellent clinicians and problem solvers. So naturally, when you move into leadership, you want to continue adding value by your own problem solving. But the challenge is that if staff aren't coached to solve their own problems, they're not going to grow. It can also lead to very significant issues for managers being very overworked and overwhelmed when they continue to try to solve the same problems for staff over and over and over again. So I would challenge you, if you're a leader who's constantly getting interrupted by staff, who want your help or opinion on questions or issues or problems that they have, before you really get irritated about all of these interruptions, I think it's important that you sit back and really ask yourself, what am I doing in my own leadership role that might really be contributing to this dependency behavior that staff has? So, a key habit for maybe some of us, maybe not all of us, but a key habit to break is to try very hard to avoid being an advice monster, the little advice monster we have on the screen right now. Because what we know is that the best solutions for staff to challenging situations are going to come from within. And managers often tell me that they get frustrated because staff don't follow their advice, and I tell them it's because maybe the advice that they're given to the staff member really isn't the best answer to the situation for that staff member. So try really hard to avoid giving advice. So say, how do you help that? How do you stop being an advice monster? Well, for one thing, you need to stop being so helpful. And that means don't jump right in to solve problems. Don't immediately give solutions to problems when people ask you for them. Don't always try to add value to every conversation by saying things like, well, did you think about this? Did you think about that? Did you think about this? And most important, ask lots of questions. So, for example, if a staff member comes into your office and they have a problem that they're struggling with, or they just want your opinion about it, rather than to jump right in and give your opinion, instead ask questions like, what have you tried already? What do you think the right approach is in this situation? What would you do if I wasn't here? That's a really good question to ask. What solutions have you already thought about? Wise managers recognize that they tell their staff, don't come into my office with problems before you've thought about at least one or two solutions to the problem that we can discuss. And that really forces your staff to begin to become a lot more solutions oriented rather than just relying on you for guidance in every situation. Now that we've looked at some of the changes that you may need to make in your leadership to be more coach-like, in part two, we're going to focus on a model of coaching that you can use in your practice and some key coaching skills that you need to develop. One widely used model of coaching that's used by really coaches internationally is called the GROW model. And I like it because, number one, the acronym is easy to remember, but I think it's really a good model to use in our coaching practice. So we'll go through every step in the model. So the G in the model stands for goal. And this is where we start with our coaching situations. What do we mutually agree on needs to happen or change in this situation? So let's use an example of a new graduate that works on your unit. You have a med-surg unit as an example. And that new graduate, you're the manager, the new graduate comes in after 6 months, and she tells you that she wants to move into a formal leadership role, such as an assistant nurse manager. So that's the goal in the conversation that you will focus on, her professional career goal of becoming an assistant manager. So that's the G. The R is the reality. And the reality is, where is this staff member right now in terms of achieving the goal? Now, the fact that she has only 6 months experience is part of the reality that you're probably going to want to discuss with her. Because let's say in your organization, ideally you want your assistant managers to have a year or two experience. Obviously, she's short on that with the current experience she has. Another example might be part of the current reality is she's not even taking charge. So she's not acting in a charge nurse capacity. And that might be leadership growth or experience that your organization might also want the nurse to have in order to be able to move into the position. So those are the realities. The O in the model stands for options. And a good question to ask in terms of options is that what needs to be true that's not true today in order for her to move forward, and how do we get there? So part of the option might be, she needs to get the charge nurse experience as an example. She needs to have more clinical experience. There might be other types of leadership growth activities she could have. And then the W in the model is the way forward, and that's next steps. So you could, for example, look up when is the next charge nurse program scheduled in your particular institution, and give her the advice that you think that might be a good program for her to attend. And then once she attends that program, then you could look at transitioning her into other leadership roles. Other types of leadership opportunities that might be available might be other things you talk about in terms of the way forward. The important thing is that that step needs to be owned by your staff member, not by you. So they have to assume the accountability to follow up. Now, great coaching, as we said before, is solutions oriented. It's also future focused. You don't want to spend a lot of your time really rehashing the past because it is not productive. If you really want to move forward in any coaching conversation, keep it future oriented. This is what we need. This is where we are right now, but this is what we need to do to move forward. When you're coaching, there's 5 core skills that you need to be attentive to. And we're going to talk about each of these 5 skills that are up on the screen right now: the fully present, active listening, powerful questioning, direct communication, and follow-up accountability. We're going to talk about every single one of those individually. So the first skill is to be fully present. Now, being fully present is easier said than done. Busy leaders really have to work very hard to avoid the temptation to multitask when they're talking with their staff, to look at their computers, look at their phones, maybe not maintain eye contact. You need to show that you're there and that you're really listening by nodding and really asking for clarification about things that are said. That's how you can really stay present in the conversation. I recently had a young nurse tell me that she never felt like she was being heard by her nurse leader. And I said, why is that? Why do you feel like you're not being heard? And she said it was because she never went in the office when this leader wasn't multitasking, doing a variety of different things, even during her formal yearly evaluation. And I asked her, I said, well, how does that make you feel? And she told me it made her feel invisible. So that's something for us to think about in leadership. You don't ever want to make a staff member of yours feel invisible. So being fully present is really a skill that we all need to really work on. When coaching, and this is important, our second skill is actively listening. When coaching, you should really aim to spend about 80% of your time listening. That means you're only spending 20% of your time talking. Now, listening is a learned skill. For some people are just naturally good listeners, but most of us have to work harder at it. It's just so easy to tune people out when they're talking, especially when you're busy. So some of the things that you want to work hard to as you're listening is, one is resisting the temptation to really finish the sentences of staff. Nurse leaders often say to me, what do I do when I have a staff member come into my office and they want to talk to me, and they sit down and they're in the midst of telling me this really long story, and they're just not getting to the point. And so I find myself interrupting, cutting them off. I say, well, if you know that your staff member has a tendency to go on and on and on with their story, I would, from the very beginning of the conversation, really make it clear to them that you have a very short period of time, that you want to be sure to hear all of the key points that they want to tell you. So they need to be as concise as they possibly can. And that's a coaching conversation in and of itself. So actively listening. The real power in coaching is really in the questions. And so you want to keep your questions open-ended. And an open-ended question, for example, is tell me more about that. What is challenging for you here? You want to avoid questions where you begin the question with why, because it can really cause a level of defensiveness in staff that will just shut down the conversation. You know, let's say as an example that you're doing some performance coaching and you have a nurse on your unit that has violated a policy, and you're trying to coach him or her around what happened here. If you begin by asking, why did you do that? You can see just by the way I'm asking the question, it's going to put the staff member on the defensive. If instead you just change the language a little bit to what led you to do that, it really opens up the dialogue. Now, sometimes in your conversation, there may be pauses, and even long pauses. What I'd like you to work hard to do is to avoid the temptation to jump in and just fill the vacuum, the silence vacuum. Because what we know is sometimes the most profound ideas and the most profound recognition on the part of staff will come after silence. And Michael Bungay Stanier, who's really an expert in coaching, he said that a very powerful question to ask when you're in the silent mode is just ask the question, and what else? And then be okay with the silence. Work hard as a leader to be okay with silence. It's just not an empty vacuum. It is, as this slide says, can be full of answers. Now, in our leadership and in our coaching, we need to practice direct communication. In other words, we need to keep it open, we need to keep it clear. When possible, use stories to identify blind spots. Avoid using words like no, but, however, because these are trigger words that can easily shut down the conversation. If you're objecting to something, or you have something, that a perspective that you want to add that you think that the staff member just didn't think of, you can use yes and. They use that in comedy improv. It really opens up the dialogue. Yes, and you might want to consider this as well. Now, Brene Brown, we have a quote from her on this slide that says, clear is kind and unclear is unkind. And she talks about the importance of clarity in communication and leadership. Because so often in leadership, we use what I will call the sandwich approach. And that is the approach where we start with the positive recognition, then we talk about the problem, that's the middle of the sandwich, and then we finish up with positive recognition again. And this can be okay. There's nothing wrong with the sandwich approach if you're clear in the conversation about the middle and the discussion of the problem or the challenge. You can use it. Just be clear. Many times you'll find that your staff have self-limiting beliefs about their own abilities that you have to call out as part of the direct communication that you're using with them. Clarity is especially important when you're talking about the way forward, because leaders should not own the goals. The staff members need to own their own goals. Many leaders like using the SMART framework when goal setting, and this is because it really keeps what is going to happen very specific, measurable, agreed upon, realistic, and time bound. So you know exactly what's going to happen, when, and how, and who's going to do it. The feedback loop is really important in coaching. Otherwise, things will just get lost. There's some people that are very good with coaching conversations, but that's where they leave it. It's kind of a one and done. And that is not effective coaching. Effective coaching involves following back up with that feedback loop. We had this conversation, we talked about this. How are things going? Where are you with the progress on the goals that we've discussed? It's all about this promotion of follow-up and accountability. Extremely important. Now, one of the questions that I often receive in leadership workshops is, how do I get started with this? If I've never done this before with my staff, and maybe I've been in my role for 5 or 6 years, and so here I am going to try a whole new technique. And what if my staff finds this to be very weird or even very intrusive, because all of a sudden I'm starting to ask them a lot of questions, which is something that I've never done before. So in this final section, what we'll talk about is how can you integrate these skills into your practice, and what are some next steps that you will probably want to consider trying. Before we do that, I'd just like to talk about some situations where coaching is not the right approach, because that's important to realize too. You don't want to coach in every situation. And an example are emergency situations, such as, let's say you're involved in a cardiac arrest. These situations are time sensitive, and as you know, experienced nurses, things need to happen quickly. And as a leader, you are often doing more telling than coaching. The coaching would come after the emergency situation, where you're doing a debrief about what happened, and then you can coach through the debriefing, but not in the moment, because oftentimes the coaching and asking all these different questions during an emergency will just take too long. A second situation when not to coach is when there's been a really clear policy violation or a medical error. And most health systems have really very standardized approaches in how they handle policy violations and medical errors. And the leaders are expected to follow these policy guides in these situations. And it usually does not involve the kinds of coaching conversations that we've been talking about on this program. A third situation where you don't want to coach is in the area of impairment. It's really clear to begin to understand the difference between coaching and mental health counseling. And when impairment is involved, you're not a therapist. And again, most health systems have very specific guidelines on what you need to do if there's any suspicion that nurses have impairment issues. And those are guidelines that you would be expected to follow. And then finally, when a problem or situation has moved into the disciplinary action phase. Again, this at that point, we are really past the coaching phase, because most health systems have really clear guidelines about how disciplinary actions need to be managed. It's usually a set sequence of events. Might start with a verbal warning, might move to a written warning, could move to a reprimand, could move to a suspension, and finally a termination. And it wouldn't be appropriate to really initiate coaching in a situation where you've clearly moved to disciplinary action. Now, one of the things that often comes up in the coaching classes that I teach is if you're in a situation where your health system is unionized, um, and a staff member requests to have a union representative present in a coaching conversation, should you allow that or not? I think that's a very individual thing on the part of the manager, but I think that most managers that I've talked with, if the staff member is more comfortable having the union rep there during coaching, They're fine with that, although most tell me that if most staff don't necessarily want to have their union reps there during coaching, because we're really at that point we're not talking about any disciplinary actions. We're just talking about probably professional development or career development. And even though they might be entitled to have the union rep there in any conversation with the manager, they'll probably decide not to within the coaching conversation. But there are many opportunities for coaching conversations, and this slide refers to probably the four major types of coaching conversations that you'll find yourself in. The first one is performance management, and these are around specific performance issues. Time and attendance would fall into a performance management issue that managers frequently find themselves coaching around. Coaching for professional development, that would be coaching around areas like critical thinking, skills, um, you know, uh, really developing your own time management in your work in nursing. Those would be examples of professional development. Career development, we used an example earlier in the program of a nurse that wanted to advance into a leadership career that would kind of lead to a career development kind of conversation. And then promotion of resiliency. And we have a separate program that we're going to be that we have as part of this series to really discuss these conversations, because when you think about what's happening in healthcare today with the pandemic, but certainly not limited to the pandemic, there's lots of stress, potential for burnout, and so promotion of resiliency are really important conversations to have with staff. So this slide really outline some examples of some very coachable moments. You know, for new staff, you probably want to help them with the development of their clinical judgment. So a question on leadership rounds for staff might be something like, what's the real challenge here for you in the patient's care, to get an idea of what the way staff are really prioritizing and thinking about care. For experienced staff, I'll give you an example. If they're preceptors, asking experienced staff, you know, what precepting approaches seem to be working most effectively with some of our younger nurses. For nurses who take charge, sometimes one of the challenges in healthcare today is that you really have to deal with issues like staffing variances. So asking a charge nurse a question like, tell me what went into your decision to call that additional nurse in to work that shift last evening, might be an example of a question you might want to ask of a charge nurse. And then team coaching around asking a question like, you know, what's working well on this team and what are some areas where the team could improve. So many opportunities, coachable moments in your leadership practice. Um, you know, how do you get started? And that's one thing that managers always ask me, you know, what are some good questions to ask staff? And what I encourage is, we have questions not only in the book, we have lots of questions in the book, but some of the questions that I've outlined in the slide here are ones that managers particularly like to ask. What's on your mind? That's a really open-ended question. You don't know where that conversation is going to go, but it's interesting to hear about what staff are thinking. You know, what matters most to you in your practice? That's a really important question to ask. Um, Sometimes if you have staff that are disengaged, and we're going to be talking about that on a one of our later videos as well, question like, what talents do you know that you have that you're not using, and how can you do more of the work that you love, especially if you think that staff are maybe a little stressed and burned out. Asking questions like, what actions do you need to take but are avoiding? So what I think is really helpful for leaders is just don't try to start with all of these questions. Just pick 2 or 3 go-to coaching questions that feel comfortable for you to ask, that you really feel will open up the dialogue with staff. Choose those and start using them. Finally, I'd say just get started. You know, choose a few situations each day to try to start being more coach like. Whether it's the end of the shift huddle, whether it's leadership rounds, a staff meeting, what does this mean? This means, when I say more coach like, I mean, ask some great open ended questions like we talked about. When you ask the questions, stay curious with the answers. Really listen to what is being said. Talk more, talk less, and listen more. Um, Third, believe that staff can solve their own problems. So the next time somebody brings a problem into your office, ask a question like, what solutions have you thought about? What have you already thought about? Or what would you do if I wasn't here? And then don't, to be more coach-like, don't get defensive if a staff member seems to be questioning your judgment. A great question to ask is, tell me more about that. Tell me more about that. So getting started. Just a reminder, today is one session in a 10-part video. The other 8 videos can actually be watched in any order, so really choose the ones that are most meaningful to you at this time. And then sometimes if you find yourself in a situation where you just want to go back and watch one as a reminder, they can serve as a good reminder before you actually have the conversation with a staff member. In closing, I'd just like to encourage you to consider bringing a nurse leader coach workshop on site for your leaders and emerging leaders. Now, we can do these workshops for up to 50 staff in an all-day session. It's not only a very affordable way to bring outside leadership development to your staff, but it's also highly interactive. And one of the things that we do as part of these workshops is I do a pre-assessment, and both an online pre-assessment with your staff to find out how much coaching they're currently doing. But I also personally interview between 5 and 10 of your frontline leaders. So whatever scenarios that we use in the workshop are ones that are really meaningful and important to your leaders and meet their needs. So the contact information, if you are interested in doing that, is up on the screen. And I'd just like to really thank you for watching this program and encourage you to watch others in the future.